Hey everyone, what's up? Good morning. This is Dr. Charlie Johnson, physical therapist. I want to start off with kind of a different type of question today. Are your friends, are your family, are your coworkers, are they keeping you stuck in pain? Right? There's this old saying, a couple of them actually. It's like, hey, you are the average of the 5 people who you most hang around with, or your network determines your net worth. But in this case, your network may determine whether or not it works, meaning the treatment that you're trying to resolve your back, butt, or sciatica pain works. And why do I say that? Well, if pain is a dangerous signal, then fear, worry, and concern, and all the things I usually chat about are also dangerous signals. And your pain can be fueled by the attention that you give it and/or that is prompted and therefore given through conversations with other people. And so I want to kick this video off with that question. Do you have an environment, a family environment, a work environment? Do you have a personal environment that is conducive to actually solving this problem? I have a post from someone inside my coaching program, and this prompted me to shoot this video from Laura. Winning. Hey everyone, I want to share my experience so far in the GRA program, the Glute Relief Accelerator program. I've been dealing with sciatica for the past 4 to 5 months, 4.5 months. I've had family members telling me, you have to get better. You need surgery. You should do physical therapy. It created fear in my mind that if I don't do something, I will never get better. Well, listen up. I started the program this Monday, and the last few days I've had 50% less pain in just a few days. This is from me simply letting go of all the garbage and fear in my mind. I know I'm going to have bumps in the roads and setbacks, but I'm very excited about the future. Thank you, Dr. Charlie, for the program. All she did was set some boundaries. And all she needed to realize is that there's a process she could follow. And there's a proven path. And it's just right in front of her. And all she needs to do is just walk it, just like I'm walking right now. Right? And so something to think about, and maybe kind of 3 tips for you. If you have a family, you have friends, you have coworkers, you can still love them. Right? But realize that they might be keeping you from getting better, and here are some things that you can do, all right? So the first thing I would recommend is that you ask. What do you ask? You ask politely, and you set the boundary that, hey, we're not going to be talking about my pain. I'd appreciate if you wouldn't ask me about my pain, because what I'm learning is that attention and focus and continual conversation about my pain can actually make it worse. So can you respect that? And they're really your family and are your friends. Or like that old song, right? You find out who your friends are. I won't start singing that. I think that's a country song though, right? They should respect that, right? And they should say, okay, no problem, right? So I think that like words are energy, and if you constantly have that negative energy and that negative input, that yucky input in my terms, right, into the system, into the mind, creating fear like it did for Laura, acting as a trigger like it has for so many other people I've worked with, then you want to preserve your energy and your emotional state for healing, not for conversations around your pain. Because the truth is that most of the times they aren't productive. Most people feel the need to over-explain. Oh, so I'm going to this place and I'm doing this and here's what's happening and here's what's working and oh, it's not working yet, right? Or I'm not doing anything. Oh my gosh, you need to do something. Oh, you should see the chiropractor. You should see the acupuncturist. You should see my massage therapist. They're a miracle. They did this one thing and it fixed all my pain, right? And all these people you haven't even talked to in years, right? At the Christmas party or at the Easter get-together, right? They come out of the woodwork and they start telling you how they have this magical solution to your pain, right? Or they could recommend someone who could take it away. And so it's just something to think about, all right? And again, it's one thing if somebody asks you about something and you just give a very short, brief answer or comment. Again, most of us, especially with the personality traits consistent with folks who get stuck in pain, people who are hypervigilant, people who are type A, good student, overthinkers. You want to give a good answer. You want to explain. Maybe you're even excited about what you're learning. But you've got to be careful, because the more you share, right, the deeper the conversation gets, and the more it fuels the pain experience with the tension. All right, so just something to think about there. All right, the second thing is let them know that you'll reach out, that if you need support and or you have any updates, you'll reach out and you'll let them know. I think that's pretty simple. Hey, I respect that you respect that I don't want to be discussing my pain, constantly talking about it. And so, like when I have any updates and or when I have any news, everyone loves news, right, and drama, then I'll let you know if I need support. Would that be okay? And again, most people will say, sure. And then finally, the third thing is speak up. Let them know that, hey, if I reach out and I do need help and I do need support, would you be open to helping me then? Cool. Maybe it's you need help moving boxes. Maybe it's you need help cleaning the house or prepping for a party or something like that. Or maybe you just need somebody to walk with. Not to talk about your pain, but to talk about other joys and things in life. To just blow some steam, you know. That's what you do with friends, right? They're there just to support you. And so a short video just to sort of empower you and give you the thumbs up and the permission to set some boundaries with people in your network, personally, professionally, as you embark upon what is a challenging recovery, especially for nasty nerve pain and back stuff and butt stuff, right? It's a very complicated area. And so you're going to have lots of different opinions. And you have to be careful about who you chat with and who you seek opinions from. Because everybody's going to have an opinion. And if they're not a specialist in the area, even if they are a specialist in the area, they probably won't have a very good opinion. And it's probably because, well, they just don't specialize in treating this stuff, right? So you're gonna get lots of recommendations of you should do this, or you should do this, or this worked for me. Just because something worked for someone else doesn't mean it'll work for you. Just because it worked for their neck doesn't mean it'll work for your back, or for your sciatica, or whatever it is, okay? Doesn't mean that you can't hear those things out, but it often just overwhelms people, right? And so you want to find someone that you can trust. And yes, you can only do that by chatting with people, right? But ideally, it's a healthcare provider who specializes in treating these types of problems, whether that be someone like me or someone else that you know, all right? So, set boundaries. You want to ask that people respectfully don't talk to you about your pain unless you reach out and ask for their opinion and or their thoughts, or share, rather than asking, share any updates or news about what you're dealing with. And then you want to speak up. After you've reached out to them, maybe say, hey, I need a little bit of help. Can you help me? Can you help me do this? Can you help me do that? And hopefully they'll help you out, all right? Just a couple little tips if you're dealing with, again, friends, family, coworkers, people in your network who maybe are driving your pain experience. And here's the thing, you probably know who they are. This isn't something that you probably need to do an audit of, although you could, right? You probably know the people who you're like, man, when I start talking to Aunt Bitsy, Uncle Bob, they get going. And or maybe they have pain themselves and they want to share in that. Again, it's not necessarily a bad thing. It's more of an awareness that the discussions you have and the attention that you give to your pain and the conversations around your pain can actually do more harm than good. So who are you having these conversations with? And can you ask, can you reach out, and can you speak up when you do need help? All right? Let me know your thoughts below. Was this helpful? Was this not helpful? Also, be sure to hit the like button as well as the subscribe button for notifications when we go live every single week. Thanks so much, everyone. Take care.